Hello everyone, I am Dr.Saroja Bhoi Hazra. Once again welcome you to the Baby Chakra initiated by CIPLA. I am a senior obstetrician and gynecologist from R.C. Hazra Memorial Hospital, Dhanbad, which is the coal capital of India and is situated in Jharkhand. Today I am going to discuss something about PCOD and 6 steps to get relief from it. First of all, we should understand what is PCOD. PCOD is called also Polycystic Ovarian Disease. As the name itself suggests, poly means many, cyst means anything which contains fluid. So, polycystic ovarian disease. That means in ovary there will be numbers of cysts will be present. So, polycystic ovarian disease was present earlier also, and it is also now also it is present. It is a very common endocrine disorder, and usually if we see 1 in every 10 women who are in reproductive age group, they suffer from polycystic ovarian disease. But nowadays the incidence of PCOD is gradually increasing, and so it is now a health concern for all. Almost 1 in 10 reproductive age group women. So when we will suspect someone is suffering from polycystic ovary, there is a criteria called Rotterdam criteria. According to this criteria, if 2 out of the 3 following criteria is present, then we will say someone is suffering from polycystic ovary. That means 3 criteria में से अगर 2 criteria present रहेगा तो हम बोलेंगे कि that person is suffering from PCOD. The first criteria is oligoovulation or anovulation. Oligoovulation means usually a female in her reproductive age ovulate once in every month. That means ovulation हर month एक बार होता है. But in PCOD patient, she will not ovulate every month. That means there will be oligoovulation or anovulation. Whether she will not ovulate at all or she ovulate only twice or thrice a year. That is the first part. That means the patient will not ovulate every month or she will not at all ovulate at all. And the second point is hyperandrogenism. Hyper means more, androgen means a male hormone. So there will be more androgen hormone in a female's body. Usually androgen hormone is a male hormone and it is usually present in a woman's body, but in very small amount. But when the amount of androgen rises in a female's body, then it leads to many, then it creates many problems in a female's body, and that is manifested as hirsutism, husky voice, and irregularity in menstruation. Then what is that? What is hirsutism? Hirsutism is a medical term. In hirsutism, what happens? There will be thinning of the frontal hair. This frontal hair, there will be thinning, and there will be more hair on the upper lip, and the chin, below the breast, over abdomen, inside of the thighs and back. That means there will be male pattern of hair in a female's body, as well as there will be husking of the voice, there will be a coarse voice, and sometimes they develop lots of acne in the face. That is, pimples, lots of pimples will be there in her face. And the third criteria is ultrasound evidence of polycystic ovary. That means if we will do an ultrasound of that woman, then we will find lots of cysts that is arranged peripherally in the ovary. Ovary is the site where eggs are produced in a female's body. So if 2 criteria is present out of these 3 criteria, then we will suspect is that female is suffering from polycystic ovary. So what happens if someone is coming to our OPD with obesity, irregular period, and infertility or features of hirsutism, as I have already told, then we can think she is suffering from PCOD. Then we'll do some blood test as well as ultrasound, and we'll take the history and we'll conclude whether she is suffering from polycystic ovarian disease or not. So then what will be the effect? How will suspect someone is suffering from PCOD? We will do blood test, and in the blood test, there will be some few hormones will be raised and few hormones will be less in amount. What is the cause of this PCOD? Earlier also PCOD was present, and now it is also PCOD is present, but the incidence of PCOD is gradually rising because probably the cause is not known, but so many factors are contributing for development of the PCOD. And usually it is thought that it was thought that it was genetic, and now also gene contributed. Suppose someone is having a gene susceptible for PCOD, and earlier also that gene was present in our mother or grandmother's day, but they had a healthy lifestyle. And due to that healthy lifestyle, that gene was not able to express. So they were not getting the sign and symptoms of PCOD. But nowadays, if that PCOD gene is present in our body, and due to some environmental factor, and also due to some of our behavioral activities, it activates and PCOD is developed in our body. Then what are those contributing factors? The environmental contributing factor is the presence of chemical pollutants in environment like plastic, foils, room freshener, talcum powder, room cleaner. All these have a hormonal effect in our body. And unhealthy lifestyle like sedentary habits, lots of stress or exposure to wrong diet, inadequate and poor sleep, uses of electronics gadget like mobile, computer, TV, etc. We are very much habituated to these electronics gadgets, and also if these things are within us and that gene is also there, then all these have a cumulative effect on a female's body, and that lead to polycystic ovary. So, what will happen? No clear-cut mode of inheritance is present, but we suspect if all these things are present. Then we'll do some blood test. In blood test, if you will find high androgen, that high, I've already told you, androgen is the male hormone. If it is present in high amount, then it will lead to hirsutism. Hirsutism, acne, alopecia. I've already explained you what is hirsutism and acne. And that hirsutism and acne, and due to that high androgen level, that will later on lead to anovulation. And later, when she gets married, she will land up in infertility. And again, she will come to you with infertility. And also here, if we do blood test, then there is a high rise of estrogen in the body. And that high rise of estrogen causes irregular menstruation. Irregular menstruation means she will get delayed period. That means she will not get her period every month. It may be delayed, like more than 35 days. If एक फीमेल अगर 21 to 35 days के अंदर उसका पीरियड आ रही है, that means that is normal. But if she gets her period in more than 35 days, then that is called abnormal or delayed period. तो यहाँ क्या होता है ना, पेशेंट आएगा बोलेगा मेरा हर मंथ पीरियड नहीं होता है, 1 month, 2 months, 3 months डिले होता है, and or she may present with heavy flow, or she may present with scanty flow also during menstruation, or she may have irregular menstruation. So in that, all these are due to all these are due to estrogen excess. And these irregular period, delayed period, scanty flow, heavy flow, those will be present in teenage or in early young age. And later on, after 40 years, this excess estrogen level can lead to endometrial cancer. That is one type of cancer of the uterus. And also in very rare cases, ovarian cancer and breast cancer also. And the third, and again, if we will do blood test, then there will be impaired glucose tolerance. Impaired glucose tolerance means that person is not purely diabetic, but there will be high level of blood sugar in our body. Like usually blood sugar level after postprandial blood sugar level should be less than 140. But in this patient, the postprandial, that means खाना खाने का 2 घंटा के बाद blood sugar level that will be more than 140 but less than 200. If it is in between 140 and 200, then we call it impaired glucose tolerance. They are not frank diabetic. They are called impaired glucose tolerance. So usually we find impaired glucose tolerance in this patient, and it is due to insulin resistance. Insulin is the regulator of glucose in our body. So though insulin is present in our body, but that is not properly utilized in these patients. So this lead to impaired glucose tolerance, and it is manifested as insulin resistance. That means there will be high insulin level in our body. And due to this insulin resistance, high insulin level and impaired glucose tolerance, that will be present as acanthosis nigricans or obesity. That obesity is the central obesity. That means we will put on more weight on our abdomen and in the thighs. That means कि वो obese होगा पेशेंट में मोटापा आएगा, और वो मोटापा यूजुअली पेट में ज्यादा होगा और हिप में ज्यादा होगा. And acanthosis nigricans is a skin condition where there will be thickening and darkening of the skin over neck. ये neck का जो ये portion है यहाँ, उसका skin thick हो जाएगा और dark हो जाएगा. And later on, if someone present with impaired glucose tolerance, later on after few years, he may develop frank diabetes. That means the blood sugar level will be full-fledged diabetic patient. And after marriage, if sometimes very often they find difficulty in getting pregnant. So infertility is also an issue with this patient. If at all she gets pregnant, then other problems also arises during pregnancy, like gestational diabetes, gestational hypertension. That means pregnancy के दौरान उसका डायबिटीज होगा, प्रेगनेंसी के दौरान उसकी ब्लड प्रेशर बढ़ जाएगी, एंड मिसकैरेज होने का भी चांसेस रहता है, एंड एनी टाइम फिटल डिमाइज, मतलब एनी टाइम बच्चा पेट में खराब होने का भी चांसेस रहता है. एंड द अदर मेन थिंग इज आल्सो dyslipidemia. Dyslipidemia means there will be altered level of lipid profile. If you do a lipid profile of this patient, then there will be a dyslipidemia, lipid profile alteration will be there. That means कि bad lipids will be more in our body and good lipids will be less in our body. So that will lead to cardiovascular diseases. That means there will be problem in the heart, in blood vessels. That is also a main concern for health. So if all these things are present, and then we will think if someone is, we should take care of those things. So the management depends on the need of the individual person, how the person presents with you. कोई obesity के लिए आपके पास आएंगे, कोई irregular menstruation के लिए आएंगे, कोई infertility के लिए आएंगे, कोई very rarely they will come with diabetes also. And in later life, after 40, sometimes it goes unnoticed up to 40 years. कभी-कभी 40 साल तक भी वो unnoticed हो जाएगा. उसका period भी ज़्यादा irregular नहीं रहेगा. Pregnant भी हो जाएगी. But sometimes after 40 or 50 years, she may land up in dysfunctional uterine bleeding or anything. तो तब uterine cancer लेके भी वो लोग present करते हैं. तो management depends upon the need of the individual. और patient को क्या जरूरत है उसी के ऊपर treatment depend करता है. The first and the foremost importance is given to the weight reduction. अगर patient weight reduce करता है, then 50% of the problem will be solved. So how the patient will reduce the weight? Patient weight reduce करने के लिए उसको first she should have a mind setup कि I have to reduce weight. So she should do heavy exercises, and that exercise should include 20 to 30 minutes of heavy exercise. And it should include large muscle group. That means जो large muscle जिसमें involve होता है वो सब exercise करना चाहिए, so that she can reduce her weight. The second thing is they should use fresh food, salads, sprouts, idli, dosa, and seasonal fruits, wheat, rice, green vegetables. All these fresh foods should be consumed by them. And another thing is no to any junk food or any that kind of food. And proper sleep is very important. She should have a good sleep, and she should avoid late night sleep, irregular sleep, late night phone calls, TV, because all these leads to hormonal disturbances and lead to a imbalance in hormones, lead to again obesity. And all these, if she takes fresh foods, avoid junk food, have a good sleep, and have quality sleep, avoiding electronics gadgets for much time, and exercise, all this will lead to all these will help her to reduce weight, and 50% of the problem will be solved if she attains a good weight. If 5% weight reduction will be there, then also she will resume her fertility in 70% cases, and she will get her um, hirsutism also. So, what and also she should avoid sedentary lives. The second is the treatment of the hirsutism. Hirsutism means if there is thinning of the hair, more hair in the upper lip, in the chin, the abdomen, inner part of the thighs, and the back, then we'll go for some medications also, like oral contraceptive pills. The birth control pills helps a lot, but it has many disadvantages also. And another thing is, if she takes medroxyprogesterone acetate, that is available as Deviry, Meperate, or Modus-like things, then it will have a very good effect on hair growth. In 95% patient, there will be decrease in the hirsutism. And so many drugs are also available, like GRRS agonist. It is also very good, but it is very costly, and it is given intramuscularly every 28 days. If it is taken along with oral contraceptive pills, then it has a very less side effect. And other also anti-androgen drugs like ketoconazole, spironolactone, flutamide, cimetidine, finasteride can also help in taking care of this hirsutism. Next, we'll go for treatment of this infertility. If the patient is having infertility problem, then first of all, we should give her ovulation induction drug like clomiphene citrate and letrozole, etc. And if at all it does not respond to clomiphene citrate and letrozole alone, then you can add metformin to it. Metformin is, and if clomiphene citrate and metformin given together, then it has a more effect in infertility treatment. But if the medication does not have any effect on infertility, then we can go for surgical procedures like endoscopic cauterization, carbon dioxide laser vaporization, waist resection, etc. So, and the cycle regulation is also very important, because they have an irregular cycle. If the patient is unmarried, then we should regular her cycle with oral contraceptive pills, because oral contraceptive pills contains both estrogen and progesterone, so it will have a balance effect on the body, and in long run also it counteract. It doesn't. It helps not to develop endometrial carcinoma in future. So always the patient should go for a cycle regulation, but we should not depend upon medicine much, because if someone reduces weight, then also cycle regulates. That means she will get her period regularly in almost 50% cases. So as far as possible, we should try to reduce our weight and avoid those medicines. But if at all, if she reduces her weight, then also she doesn't get her period regularly, then we should give her birth control pills and regularize her period, so that she will not develop endometrial cancer in later life, and she will have more chances of fertility later on. And next thing is, if there is hyperinsulinemia, that means if she is having more insulin level in her body, then we'll give metformin. Metformin is a drug that is given to counteract the insulin level, so that she will not develop diabetes mellitus, or we can help her to some extent in getting pregnant also. So metformin is also used. And to summarize my things, the 6 things that we must follow if we are suffering from polycystic ovary is first and first. Rather, I'll tell you in 50% cases, only weight reduction will help you a lot. It will save your money as well as it will be helpful for you. The first and foremost thing is a weight reduction. And for weight reduction, whatever thing you can do, you do. Do exercise, take healthy food, avoid junk food, refined flours, late night sleep, stress, sedentary life, take more fresh food, veggies, salads, fruits, etc. And second is limit your mobile and computer electronic gadgets use. Third thing is regularize your sleep pattern. Regularize your sleep pattern because this is very important, and this is also very important to balance your hormones. And next, treat to regularize your periods or hirsutism or infertility or hyperinsulinemia or whatever you are suffering from. And in between, you should also go for at regular interval. You should check up for your work. If at regular interval, you should go to the doctor to check whether you are having a risk factor for cancer or not. The doctors can help you in that better. So I think everybody should follow what I have explained now. Question. So
क्लिक करो बोल नहीं तो माउस
one question is there from Padmaji. Does PCOS affect for pregnancy? दो चीज यहाँ आता है. PCOS पेशेंट फर्स्ट ऑफ ऑल 50% केसेस में उनको प्रेगनेंसी कंसीव करने में प्रॉब्लम होता है. ठीक है. और अगर प्रेगनेंसी हो भी जाता है तो ड्यूरिंग प्रेगनेंसी ऑल्सो मिसकैरेज होने का चांसेस रहता है. एंड एनी टाइम बेबी डेथ हो सकता है इन द यूटरस इटसेल्फ. एंड दैट ड्यूरिंग द प्रेगनेंसी पीरियड ऑल्सो डायबिटीज और ब्लड प्रेशर होने का चांसेस रहता है. And next question is from Sneha. Does PCOS affect of body or hair or skin? हाँ, as I have already told, PCOD होने से हमारे बॉडी हेयर्स और स्किन में बहुत सारा इफेक्ट होता है. जैसे कि हेयर्स में फ्रंटल हेयर थिनिंग होगा. जैसे कि मेल पैटर्न ऑफ हेयर, जैसे मेल में क्या होता है, उनका फ्रंटल हेयर थोड़ा मैंने थिनिंग रहता है. देयर विल बी मोस्टिस एंड हेयर्स ऑन द chin. So in a female, more there will be frontal thinning of the hair. अपर लिप में हेयर्स बहुत ज्यादा आएंगे, चीन में हेयर आएंगे, इनर थाइज में हेयर्स आएंगे, पेट में बहुत सारे हेयर्स आएंगे. एंड स्किन में होगा आपका नेक पोर्शन में डार्कनिंग ऑफ द स्किन एंड थिकनिंग ऑफ द स्किन. स्किन मोटा हो जाएगा और डार्कन हो जाएगा. हाँ, नेक्स्ट क्वेश्चन रुचि जी ने पूछा है. My weight is too much. Due to that, I am not getting period regularly. What should I do? If your weight is too much, it is first of all you try to reduce your weight. पहले आप अपना weight reduce करने के लिए कोशिश कीजिए. अगर आप अपना weight 10 किलो कम कर देते हैं तो आपका पीरियड रेगुलर होने का चांसेस 40% बढ़ जाएगा. अगर 10 किलो भी कम कर लेते हैं, आपका वेट 40% कम, आपका पीरियड 40% रेगुलर हो जाएगा. Next question is how to recover from PCOD. As I have already told, it is a disease that cannot be cured, but it can be controlled if we maintain a good weight. That is, if we maintain our BMI within 20 to 25. If we maintain our BMI 20 to 25, BMI means body mass index, and it is there is a formula for its calculation. So we should try to keep our body mass index between 20 to 25. But if you are overweight or obese, then it is very difficult to maintain 20 to 25 BMI. In that case, you try to reduce your weight at least 10 kg. Someone has asked, is it possible to have PCOD after delivery? PCOD is inborn almost, it is present when you are born, but sometimes it manifests very late. That means it is present when you are born, but it is not manifested sometimes up to 20 years, 30 years, 40 years also. So after pregnancy also you can manifest PCOD. Nisa has asked, my daughter is 17 years old and she doesn't get her period regular. Do I need to check for PCOS? If she is 17 years old, usually sometimes in the beginning, पहले शुरुआत में कभी कभी irregular period होता है. So first of all, if it you should first do some go for a ultrasound and do some basic test, that is serum testosterone, insulin, LH, FSS, all these things. And if all these reports come out to be normal, then you need not to worry and you can wait for another 1 or 2 years. You have to know this for मेरा क्वेश्चन है this.
ये बोर्ड कर मजा आते हैं इन्हें ऊपर हाँ थर्टी
सची शर्मा जी पूछे हाउ टू लूज वेट टू पीसीओ हाउ टू लूज वेट इन पीसीओएस. हाँ, मैं ऑलरेडी बोल चुकी हूँ. वेट लूज करने के लिए आपको फर्स्ट डिटर्मिनेशन चाहिए. मैंने आपको वेट लूज करना है, आपको पहले संकल्प करना पड़ेगा कि मुझे वेट लूज करना है. तो फर्स्ट ऑफ ऑल यू शुड डू हैवी एक्सरसाइजेस दैट शुड इंक्लूड लार्ज मसल ऑफ योर body. And the second thing is you should adopt a healthy food habit. That means you should depend upon fresh foods and homemade foods, green veggies and all these things. You should avoid junk food, canned food, and those whatever is available in the market, fried foods. All these things we should avoid. And you should regularize your sleep pattern. That is also very important, because if you regularize your sleep pattern, then it will have a effect on your hormones, and that will also help you to lose weight. Sweta has asked, and the other thing is also nowadays these electronics gadget is very it is a contributing factor in PCOD, because what is happening, no, the hormonal imbalance is going on due to these electronics gadget uses, due to late night sleep, due to excessive phone calls. All these have an impact on our body, and that is in our hormonal systems. That means our hormone is getting irregular. So what is happening? That gene is getting expressed. Earlier, due to our healthy lifestyle, that gene, that PCOD gene, which is present in our body, was not able to being expressed. But now it is, वो जीन एक्सप्रेस हो रहा है. माने जीन हमारे पास पहले भी था, लेकिन हमारे जो मदर्स, ग्रैंड मदर्स थे, वो लोग हेल्दी लाइफस्टाइल के चलते वो जीन एक्सप्रेस नहीं हो पा रहा था, वो दब के रहता था, इसलिए वो डिजीज हमारे में उभरता नहीं था. लेकिन अभी जो हमारा ये जो सेडेंटरी लाइफ है, हम लोग बैठ के काम करते हैं, हम लोग एक्सरसाइज करना नहीं चाहते हैं, हम लोग स्पोर्ट्स वगैरह में इन्वॉल्व नहीं होते हैं, और हम ये मैंने हमेशा लैपटॉप कंप्यूटर में बैठे रहते हैं. तो ऑल दीज हैव नॉट ओनली इट इज हेल्पिंग टू गेन वेट, इससे वेट गेन तो हो रहा है, इसके अलावा हमारा हार्मोनल इम्बेलेंस भी हो रहा है. और हम हमारे चिल्ड्रंस को भी कोई ना कोई स्पोर्ट्स एक्टिविटी में एनकरेज करना चाहिए, सो दैट अभी से अगर वो लोग स्पोर्ट्स वगैरह करेंगे तो उनका हेल्थ वेट गेन भी नहीं होगा, और दैट विल हैव बैलेंस ओवर देयर हार्मोन्स. तो अभी तो पेंडेमिक सेकेंड वेव चल रहा है, कोरोना का पेंडेमिक सेकेंड वेव चल रहा है, तो वी शुड एनकरेज देम टू डू सम इंडोर गेम्स लाइक table tennis or cycling, whatever is possible at home. We should encourage them to do those exercises at home. I am Dr. Saroja Bhoi Hazra, a senior obstetrician and gynecologist in R.C. Hazra Memorial Hospital that is situated in Dhanbad. Dhanbad, that is the coal capital of India, and it is situated in state Jharkhand. So, any questions, please? Last of all, I would like to tell, first thing, we should reduce weight. We should adopt a healthy lifestyle. We should go to doctor whenever it is required. Like if we are suffering from irregular period, infertility, or we have some problem in insulin level, like if you are if there is chances of diabetes. When we suspect if कब डायबिटीज होने का चांसेस है, अगर हमको ज्यादा भूख लग रहा है या ज्यादा प्यास लग रहा है या ज्यादा हमको पेशाब लग रहा है, तब भी विल सस्पेक्ट वी मे बी सफरिंग फ्रॉम डायबिटीज, तब हमको डॉक्टर के पास जाना है. तो हमको खुद को भी मैंने खुद का भी ख्याल रखना है, और इन फ्यू केसेस में हमको डॉक्टर्स का हेल्प भी लेना है, बिकॉज दे विल प्रिस्क्राइब यू सम medicines to help you, and they will also guide you how you can manage or how you can control your PCOD. PCOD में कोई डरने वाला बात नहीं है. अगर आपका वेट प्रॉपर है और आप हेल्दी लाइफस्टाइल लीड कर रहे हैं, तो कोई डरने वाला बात नहीं है. It is not a disease to be afraid of, but it is in your health. You can control it. You can have a normal life if you adopt a proper lifestyle.